a great disconnect between these beautiful policies that are done at the national level and international level and what happens really at the grassroots. Universal health coverage is one of those things. Beautiful declaration. Kisumu County is a pilot county. And you find that the demand has been created and people are told to go to the hospital. But you get to a healthcare facility and there is no drugs, there is no healthcare worker, and there is nothing there to resemble a healthcare facility. Until I was having a conversation with someone and I was asking someone whether what they get from the facility is skilled delivery or is it just a facility delivery? Because they come to the facility and they deliver all by themselves. They deliver on the floor, everywhere, and there's just a lot of pandemonium. And when I just related to the global gag rule, one of the things that I would really want us to look at as the media is when we look at the issues that happen at the global level, they are sort of interconnected and interrelated. And the way they affect the community members are sort of in an area that if you don't sort the impact of the global gag rule, then you will never actually achieve universal health coverage. Why am I saying this? It's because one of the things that really needed us to solve the issue of global gag rule is to call for domestic funding. Because you cannot rely on donor fundings. And when they cut their fundings and they go with their fundings, we cry foul every single time that a new administration comes in and the global gag rule is reinstated. We suffer and women and the community suffer. So what are we doing to ensure that our governments actually allocate resources towards comprehensive reproductive health care? Because one of the things that we will not achieve universal health coverage if we do not solve the issues of primary health care. And that includes family planning, that includes cervical cancer, early screening, all those primary health care, nutrition, for example. So if we don't solve those issues, we will never ever achieve universal health coverage. And global gag rule is one of those things that threatens access to comprehensive reproductive health care. So when something happens at the global stage, how are we interacting with it at the national level and at the subnational level? And how are we conversing around these issues that they do not become things that the community are detached from? Because the issue of universal health coverage is very ambiguous, even to professionals. They don't know what it is about. They don't know whether it's population coverage or it's quality of services or it's curative or it's preventive. There's just a lot of pandemonium going there. So as everyone, and someone questioned who is the media? Because we have our phones every day and we are on social media. And the people that are in that space, how do you make sure that in your day-to-day you begin to brainstorm over these issues and you begin to create lasting solutions around them? Because the issue of universal health coverage is not something that is detached from us. Every day we fundraise on our mobile phones. Someone is going to India, they want money for their medical bills. Someone's child is sick, they're admitted and they've been detained in the hospital. You are raising money for them. And health is a right by the Constitution. How are we questioning these issues so that they don't become issues that are only at the UN and at a political declaration, and they become the issues that then we interrogate every single day and we get lasting solutions for them?